WASBIRT stands for Screening, Brief Intervention, and Referral to Treatment. WASBIRT is a universal public health approach to integrate behavioral and primary health care. It is a way to increase awareness that substance abuse is preventable and that treatment works. WASBIRT can be provided in a wide variety of medical and community healthcare settings. Since the launch of WASBIRT in 2013 at Olympic Medical Center in Port Angeles, Washington, over 25,000 pre-screens have been completed, which has resulted in close to 4,000 full screens. Staff have completed almost 3,000 brief interventions and referred over 1,200 patients for treatment. Out of those referrals, 42% of those patients came in for substance use disorder treatment or received a chemical dependency assessment within 6 months of their referral. WASBIRT is working at Olympic Medical Center, and here's why.
Well, I think the WASBIRT program is very effective. We have some patients that come to the emergency department repeatedly for the same type of illness related to their substance use disorder. And the thing I really like about the motivational interviewing is that it establishes some rapport and trust with the patient. So when they come back, I go in and talk to them again, and they know that there's not going to be any judgments and that the responsibility is theirs for making the change. And even though some patients come back repeatedly, it is so rewarding when they actually come in and say, okay, today's the day. I'm ready to make that change, and I can refer them to resources.
I would definitely recommend WASBIRT to other medical facilities. It's not a hard screening to do. The hardest part would probably be getting kind of what you're going to say down, and it takes a few patients to kind of decide, okay, how am I going to start this conversation? First couple I went in and did, it was, kind of reading off the form. Okay, let me ask you this question, this question, this question. And after 4 or 5 patients, you just kind of flow into a conversation and you get the answers to every question you're looking for the most part. And it really does, it gives you a perspective on your patient, and it helps give your patient a perspective on linking drug and alcohol use to their physical health, to their mental health, to just kind of their everyday life.
I would absolutely say the outcome is priceless. Again, as I mentioned, even one person that we would save, it makes a difference. That's somebody's child, that's somebody's son or daughter or mother or mom or whatnot. And being a small community, many of these situations they hit close to home. And so I think having people doing the work, again, I think one of our big successes is having Sarah and Bev and the passion that they have for the work that they do. I think that is every bit as much of a success of the program and why we have done so well. And I do hope others feel and see the value that we've experienced and want to continue to look into this and hopefully implement something like that in their facility.